hate that pre-pregnancy period symptoms mimic pregnancy symptoms. This has got to be one of the biggest mind F's in my field. And that's saying something because trust me, there are a lot. Breast tenderness, fatigue, spotting, cramping, and feeling bloated. All 5 of those symptoms overlap when you think about how you feel right before you get your period, in your luteal phase of your menstrual cycle, and in early pregnancy. And the reason for all of these symptoms overlapping is the hormone progesterone. Progesterone is one hell of a hormone/drug. It's secreted by the ovaries after ovulation. And if the ovulated egg does not turn into a pregnancy, eventually those levels drop off and your lining breaks down and you get a period. However, when implantation does take place, the early embryo secretes a signal called HCG, which then tells the ovary, keep churning out more progesterone because you need to support this early pregnancy until I have a placenta that can take over production of progesterone at around 7 to 10 weeks. And this is why those early traditional first trimester, all of those inconveniences that people talk about when they find out that they're pregnant overlap with some of the signs and symptoms that you have in the second phase of your menstrual cycle, also known as the luteal phase. And this is exactly why, as a fertility specialist, I always tell patients, try not to read too deeply into every feeling that you have during the 2-week wait, because it can be really hard to decipher. Is it coming from your normal menstrual cycle changes, or is this coming from an early pregnancy? The best thing to do is to wait and do that objective pregnancy test 2 weeks later.